to today's Adult Health 1 class session on delirium. Today we will discuss delirium in its entirety, see how the nursing process will correlate with the treatment of patients with delirium. So let's start off by checking in to prepare for today's lecture on delirium. So please go to menti.com and enter the code seen on the screen 16605986. After we do our lecture check-in, we are going to do something new today, a delirium escape room, and we will engage in that, and then we will check our knowledge learned and end our class session with a QR code of a survey for the evaluation of the course today, and any muddy points that you would like to discuss at the beginning of the class period next session. So go on and log in. Thank you all for joining. Now let's get started with our lecture check-in. All right, so please start by scoring or rating your pre-existing knowledge on the topic of delirium. Do you have no knowledge of the topic? A little bit, heard about it before but not studied it, observed it during clinicals, have a strong understanding and want a deeper knowledge, want broader knowledge, or already know everything in the course syllabus, which no one should be choosing that. Thank you all for your answers and your input, and I see that everyone has observed it during clinicals. On to our next question. All right, please rate the following. How well are you prepared for this session on delirium? So this basically just asking if you did the pre-class work on delirium. Thank you for your input. Here I would like for you all to share what interests you about cognitive impairment, especially delirium. We'll take about 20 seconds to allow you time to input those responses. Thank you all for your responses, and I see that most of you have an interest that include the prevention and treatment strategies for patients with delirium while hospitalized. I think today's session will cover that interest for you. We'll talk about it more at the end of our class session. Thank you for sharing. Please don't hesitate to ask any questions that you may have during our class session today. Alrighty, thank you all for participating. Alright, so now we are going to do our delirium escape room. Here I would like for each and every one of you to be engaged and apply what you've learned to help your patient escape the acute and chronic consequences of delirium. So let's get started. All right, so now you have entered into your patient's room, and we have several items that look on with embedded links. So where would you guys like to start? The start here may be a great place. So here's instructions on how to help us help our patient escape delirium. So we're going to start by following the links and watch a brief video, and then answers to these questions will yield a key to unlock the first of 4 puzzle pieces necessary to help your patient escape. So we're going to watch. So click on the video, but I ask that you all have fun during this virtual delirium escape professional development journey. Your engagement, confidence, and commitment will impact the quality of life of your patients. So we've watched video. Now I would like for you guys to answer these questions. So let's get in 2 groups of 4 and answer those questions. I'll give you guys about 5 minutes. All right, thank you all for answering the questions. The last option is to put those answers together. We're going to enter the first letter of each of the true or false answers in order on the first 4 lines below. The second 4 lines will be your answer to your question number 5, and this will yield an 8-letter key that will unlock the first puzzle piece. I want you to keep in mind that all are going to be in caps. So we're going to go back to our Delirium Escape Room. And we're going to click on puzzle number 1, and we're going to input that lock key, and then it will allow us to go to our next clue. Our next clue will start by clicking on the patient's chart. So we're going to click on the patient's chart and find our patient's or branch, look at all of her history, allergies, her review of systems with her head-to-toe assessment, and her diagnostic lab results. Now we're going to go back and we're going to click on our puzzle piece number 2 and answer a few questions through an S bar because we're going to call the doctor and tell him about our patient. So we call the doctor, and now I want you to work up a diagnosis of your patient based on the orders that the doctor gave you. He suspects delirium, so let's look at a few things on delirium. So we're going to click on the delirium overview. Read this today on the diagnosis stages. All right, thank you all for reading on that. Are there any questions about delirium and our patient? Well, what are some of the things that we can expect? So let's watch a video about delirium and how to assess.
Welcome to the instructional video on the confusion assessment method. My name is Susan Heidi, and I'm from the Hospital of...
Now you can click on puzzle piece number 3 and answer the puzzle piece key. That will give you your next clue, and then we're going to click on our patient to see how she's doing, and then we'll click on puzzle piece number 4 and enter our key from our second patient assessment. And it seems like that you have given all of the treatment, interments, and your patient is no longer experiencing delirium. Our Delirium Escape Room Kahoot questions. And get ready to join by entering the game PIN. All right, now that everyone has joined, we're going to start our game. We're going to start with our first question. Which intervention is most appropriate to promote a safe environment for the elderly patient with delirium? All right, great job, Chamberlain. You are leading. And one of the questions earlier was your interest in the prevention and treatment strategies of delirium. So we can do that by anticipating behavioral changes, addressing our patient's needs, early resolution if we have a diagnosis of delirium, prevent complications, prevent functional loss, and improve our patient's quality of life while they're hospitalized. All right, this has been our class session on delirium today. Please scan the QR code to complete the survey for today's class session. Please do not leave the question blank that asks you for any challenging points that you would like to be discussed at the beginning of our next class period. Thank you all, and see you next time. Bye.